Hi there, I'm Jennifer Kosova, founder of Noble Functional Medicine. I want to talk today about men's health. Men's health is more than just testosterone. I see a lot of men seeking help because of low testosterone symptoms, and we do find low levels when we're looking at these guys. But if you are only giving testosterone to the problem and not doing a little bit of research to find out why there is the low energy, or why there's brain fog, or why perhaps you're having a difficult time gaining muscle or losing that tire around your waist, then you might be doing yourself a disservice by focusing only on replacing the testosterone. There's a lot more to the story than just testosterone, as you'll see here in a moment. So testosterone is only part of the story. It's the signal to go ahead and make muscle. And so in order for that to happen, you first have to be making sure that you're giving your body the appropriate amount of amino acids, and that comes from the protein in your diet. I can give you all the testosterone in the world, but if you don't have adequate protein, you're not going to build muscle. You'll have no substrate to build it with. You also need a certain amount of carbohydrates. Carbohydrates are really important to fuel the chemical reactions that the testosterone actually makes your body do. For instance, the B vitamins are integral portions. The B vitamins are integral components to this process. So if you're not getting enough carbs, you're probably not getting enough B vitamins either. Without movement, you're not going to build muscle. Muscle builds in response to resistance training. And so, if you're just doing SoulCycle and you're not putting any emphasis on resistance training, then chances are you're not going to be effective at building muscle no matter how much testosterone you get, no matter how high your levels are. If you don't have adequate testosterone, then you probably are not going to have adequate estrogen either. Men need estrogen. It's actually protective to your heart and to your bones. And so since testosterone will metabolize into estrogen as one of its metabolites, by having adequate levels of testosterone, you're also then going to metabolize and have some good levels of estrogen that will protect your heart and your bone, make your bones stronger and less likely to break as you get older. Your sex drive is actually the effect of DHT and not really testosterone. One of testosterone's metabolites, DHT or dihydrotestosterone, it actually has 5 times the binding affinity or love of the receptor for the androgens. And so DHT is a very powerful metabolite of testosterone. It's actually the one that crosses the brain barrier and is responsible for your libido. And so if you've been having low libido, it might not just be the testosterone level, but it might be the way you metabolize to DHT. Maybe you over-metabolize to estrogen. Really important when you give a gentleman testosterone, or a female for that matter, you have to know how it's going to metabolize. Almost like if you're going on vacation and you have a plant that you want to put a bunch of water in before you go, you're going to pour some water in it, but you want to make sure that that plant has good drainage holes, right? Because otherwise you're going to overflow the plant and it's not going to drain. If you did that with testosterone and you don't know how it drains off, what the metabolites will eventually bleed off to, then you could be causing somebody a spike in their estrogen or in their DHT. And having those levels optimal is great. Having them too high could be dangerous and lead to side effects like gynecomastia or male boobs. High levels of DHT can lead to what we call male pattern hair loss. And so we want to make sure that before we pour that liquid in, we want to make sure we know how the drainage is on the back end. If you're not getting your levels monitored, then you really are at risk of developing these issues if you're metabolizing too high in one direction or another. And so really not only getting the actual levels monitored, but making sure that we're keeping track of the free, not just the total testosterone, and all the metabolites that go along with it. You can't just give somebody a shot and be happy that they're gaining muscle and never look under the hood at what's going on. Also, the dosing and the frequency is important. The more frequent you give testosterone dosages, the less high peaks and deep the troughs. you get a smoother baseline. And the smoother the baseline, the less likely you are to have buildups of metabolites. And so, for instance, some men will go in and get a shot every 2 weeks of a really high dose. That's going to cause a really high peak of testosterone that the body has to deal with. And it deals with by metabolizing it as quickly as possible. And so then you get a bunch of estrogen or a bunch of DHT or both. And sometimes those excessive metabolites can cause those issues that I mentioned before. So dosing and administration is really important to have ironed out as you start to make your plan on how you're going to replace testosterone. Why your testosterone might be low to begin with. Well, if you look at charts over the years, you'll see that the average testosterone has been dropping and dropping and dropping. And one of the main reasons for that is because we're getting fatter. The more body fat we have, the more we are changing our testosterone into estrogen. That metabolism that I talked about before can be driven even higher towards estrogen in the fat cells. The fat cells have chemical reactions inside of them that will take your testosterone and change it into estrogen. And so that's one of the reasons why we're seeing lower testosterone. It's also matching a rise in estrone, which is the type of estrogen that's formed within the fat cells. So that type of estrogen is a more toxic metabolite. It tends to create more problems with tissue overgrowth and potentially can turn into cancer or an increased cancer risk if not metabolized correctly, which is why it's really important to look at liver function, make sure the liver is functioning clean, and do as much as we can to lessen the burden that we're putting on our liver so that it can do the job in getting rid of our metabolites of all of our hormones that we have endogenously. Inflammation is also going up, right? We have high sugar diet, high saturated fat diet. We have a lot of toxins in our environment and in our foods, in our food manufacturing and in our agricultural industry. Also allergies, right? We can develop sensitivities to a lot of foods. The more of a toxic load we put on our GI tract, the leakier our GI tract gets. We break down the barriers that are supposed to regulate what stays in our colon and what goes out of it. And a lot of times when we have leaking within our GI tract with these barriers not intact, then we become sensitive to foods that we wouldn't normally be sensitive to because those proteins aren't typically found in our circulation. They're normally in our GI tract. When they come out, our immune system will make antibodies to them. And that's when we find positive tests to milk allergies and peanuts and other things that we normally have been able to tolerate, but the body now is being exposed to them in areas that they don't normally see these proteins, and the body is recognizing it as a foreign invader. Head injuries also can cause low testosterone. If you think of your testosterone as a factory, the boss, the head of the operation, is actually the brain. The brain sends a signal to the testes, or in the case of females, to the ovaries and the adrenal glands, and tells it to squirt out some testosterone. And so, head injuries can interfere with that signal. And so in somebody with a low testosterone, it's possible that the low signal to make it is coming from the brain. The testicles might be raring to go and ready to make the testosterone, but they're never getting the signal from the supervisor telling them to turn on the machine and crank up manufacturing. Pesticides and plastics in our food can have chemical particles that look a lot like estrogen and fool the body into thinking that there's estrogen there. When your body has adequate or too much estrogen, then it will shut off the signal to make hormones. And so that can shut down the signal that comes from the brain telling the testes to make testosterone because the body thinks it's chock full of hormones already. And so it dims down the production. The metabolites that we talked about briefly before, estrogen. Estrogen is one of the byproducts that testosterone breaks down to. And estrogen is protective to the heart. It has a positive effect on your cholesterol profile, on your brain health, and on your bone health. If you have too much of it, though, that's not a good thing. You can have man boobs, gynecomastia. If it's too low, you can have a bad mood. Your libido actually partially is formed by estrogen, and your energy. So you do need some. Don't block it all the way down. I see some patients that come to me on testosterone that already have a built-in estrogen blocker in them, and that's bad news. If the testosterone causes peaks that are too high, we can dose that separately, but not every day, and not with every dose of the testosterone. It's not always needed at that level. You do want to get some estrogen effect from your testosterone. DHT is the testosterone that goes to your brain. It crosses the blood-brain barrier. It binds to the androgen receptor with 5 times the strength of your regular testosterone, and it's responsible for your libido. A lot of guys ask, well, then why don't I want it as high as I can get it? Well, because you also have a lot of those receptors in your hair and in your prostate. And so the more DHT you have, if you're prone to male pattern baldness, then you might suffer from hair loss. And the problem is, when that happens, you don't usually see it until it's about 6 months down the road, because hair usually is responding to whatever happened to it 6 months ago. And so it's really hard to catch it immediately to stop it. If your DHT is too high, it can stimulate the prostate to grow too much. And since the prostate surrounds your urethra, which you pee from, like a donut, if it grows, it can squeeze that urethra, causing it to be very difficult for urine to get out. The treatment is opening up that urethra, and that's a procedure that is not easy to describe to a man without him cringing. So that's not something we want. We do everything we can to avoid that from happening. And so keeping the DHT within a good range and making sure we're checking it. A lot of the men that come to me from testosterone clinics have never had their DHT checked. And that's really significant, because missing a very high level can lead to these conditions such as enlarged prostate or hair loss that no man wants to deal with. And so very important to do simple screening for that. Testosterone is converted to estrogen in your fat cells. We talked about this a little while ago. So it's not really always how much testosterone you need, but are you losing it to estrogen? And if that's the case, then the more testosterone I pour into you, if you still have that fat, then it's going to convert it to estrogen. And so you're not going to really get the full benefit until you get rid of some of the fat, so that you can use the testosterone you have to build muscle and keep only a small portion of it turning into estrogen to protect your heart and your bones. But tackling the fat at the same time through managing glucose and the blood sugar and insulin sensitivity, making sure the other hormones are working effectively, like the thyroid gland. These things are all so important. You can't just replace the testosterone and expect it to fix all of the downstream problems. Sexual function, it's all about pressure and flow. One of the main reasons people come to me to find out about their testosterone is because maybe they've had some problems with erectile dysfunction or maintaining an erection. And, you know, almost all patients that have erectile dysfunction will respond to Viagra to a certain degree. Viagra is a medicine that helps fill up the penis and keep the blood inside of it. And so the fact that so many people respond to that tells me that the problem is actually more because of blood flow and has less to do with the testosterone levels themselves. And very frequently, it's the case that I find a patient that has erectile dysfunction also has elevated triglycerides, elevated cholesterol levels, signs of inflammation. When that's present, I worry very much about this person having a heart attack. They've actually done a study that shows that 15% of men that suffer erectile dysfunction will have a heart attack within the next 7 years. The erectile dysfunction is the canary in the coal mine, guys. This is telling me that these small vessels are only a tiny bit smaller than the ones that feed your heart. And if these vessels are in trouble and experiencing symptoms, the heart is next. So in these people, not only do I make an effort to address the erectile dysfunction, try to find treatments that will help, like vasodilators or the class of medications that Viagra is in. Maybe they do need some testosterone to boost that DHT level a little bit and get the estrogen up for mood and libido. But I also need to make sure that I am very aggressively screening them for cardiac risk, getting their cholesterol under control, getting inflammation under control, blood pressure, and looking for any signs of metabolic syndrome, poor management of their fasting glucose and insulin levels, and work on all of this rather than just throwing testosterone at the problem. As I think makes sense now, testosterone is only one piece of the puzzle. We've talked about insulin resistance. If your fasting glucose is high, if you require more and more insulin in order for your body to gobble up the glucose it's been given, you're going to store fat on your liver, you're going to get inflamed, you're suffering from insulin resistance. When this happens in the brain, since the brain is the highest utilizer of fuel in your body, you're going to start to see brain fog and cognitive decline. This means your brain can't access fuel as quickly and as readily as it should be able to. This is why we're starting to call Alzheimer's disease diabetes type 3. In the muscle, you can suffer from insulin resistance. This is when you don't move your muscles enough. Your muscles actually have an independent mechanism for sucking up glucose all by itself. It doesn't need insulin to do so. So the more you move your muscles, they can actually overcome this insulin resistance. But if you don't do this, your muscles also come resistant to that insulin, and they do a poorer and poorer job. And so you can exercise and it doesn't affect you as much as it used to. This is a sign that the system is breaking. This is what ends up leading to diabetes and then ultimately Alzheimer's. Cholesterol and lipid disorders. If we're not looking at the triglycerides and treating that, if we're not looking at the cholesterol levels and being aggressive enough with them so that you're not laying down plaque in your arteries, and if we're not screening for hereditary disorders in management of cholesterol or building cholesterol particles that are big, ugly, dangerous cholesterol particles, then we're not going to be able to identify the people that are at higher risk and treat them. We really need to be more cognizant and treat with more of a 30-year lookout than a 10-year lookout, which is currently what we do in practice in this country. Metabolic syndrome is when both of these systems above are going wrong at the same time. Poor insulin utilization with insulin resistance, poor cholesterol management, elevated triglycerides, all contribute to what we call metabolic syndrome. Waist circumference greater than 40 in a male and greater than 35 in a female. High triglycerides, fasting greater than 150. Low HDLs, which are the cholesterol carrier molecules that bring the cholesterol back to the liver to get rid of it. Blood pressure that's over 130 on the systolic end, and a fasting glucose that's over 100. If you have any three of these things, then you have metabolic syndrome. These are the patients that we screen more aggressively. We do liver scans, the fiber scan of the liver to stage their liver tissue, make sure that they don't have fatty disease of the liver, and if they do, we want to stage it. We want to see, are any of those fatty cells fibrotic? Because once they cross the line from fibrotic to scarred, then it's no longer curable. We need to treat the liver, keep the liver healthy while it's still has healthy repairable tissue. We monitor these patients very closely. These are patients that the GLP-1 drugs might be a good intervention for in addition to or before starting testosterone replacement. Definitely getting these factors under control are more of the base of the pyramid, where testosterone is more at the peak of the pyramid. And so you can see how if you were only paying attention to your testosterone and only treating that, not looking at the metabolism factors that come from it, not looking at the things like metabolic syndrome and high cholesterol that can cause problems with normal weight, energy, and brain fog in addition to low testosterone, then you're only really seeing a tiny piece of the puzzle. At Noble Functional Medicine, what we do is we look at the patient as a whole. We start at the bottom of the pyramid and look at the metabolic functioning. We treat all of the things that we find that could contribute to metabolic disease and inflammation. And then we also look at the hormones, optimize them, monitor their metabolism, and adjust any metabolites that we need to before they cause side effects, and so that you can laser focus your attack on your body composition, your energy, your mental acuity, and really get the results that you were looking to achieve. If you'd like to book a discovery call with me to talk about your individual situation, I would love to hear from you. Please feel free to reach out. Thank you so much for your time. I look forward to talking with you.